So this video, I'm not really going to explain stuff. I just put a bunch of opposite contrasting terms as examples to show how all of these concepts come in pairs. And I'm just going to go through and name these examples so that if you're trying to split things into pairs and compare things and use the versus technique, you can use this as kind of an example of what that looks like. So I'm just going to go through them, just read them out. Dilated versus restrictive cardiomyopathy. Hypertensive versus hypertrophic cardiomyopathy, which are both a subset of bulky restrictive cardiomyopathy. Aortic stenosis versus HOCM. And actually, I rather prefer aortic stenosis versus HOCM, which are both obstructions that the left ventricle has to push against, because HOCM has a left ventricular outflow tract obstruction. But another one I could do is MVP versus HOCM, because these are the only two murmurs that do the opposite of what they're supposed to do when you do the Valsalva maneuver. All the other murmurs act the same way. These two are the exception. Fibromuscular dysplasia versus arteriosclerosis. These are the two types of renal artery stenosis. So these are basically the two ways that the kidney can get blocked, the renal artery can get blocked, and you have super bad, super high refractory hypertension that doesn't respond to treatment. This will happen in a young person, this will happen in an old person. They're opposites. Back to this hypertensive versus hypertrophic thing. This happens in old people because they have high blood pressure for their whole life. This happens in young people because they were born with it. So it's degenerative versus developmental. Those are big categories that we learned from Dr. Boyer for categorizing diseases. This is degenerative, old people. This is developmental, young people. They're born with it. This is degenerative, old people. It's from a lifetime of high blood pressure. This is developmental. It's young people, young women get affected by it. It just happens for no reason. Restrictive versus obstructive for pulm. All pulmonary diseases fall into one bucket or the other, restrictive or obstructive. That's also equals lungs versus airway. Lung problems versus airway problems. The lungs are restricted from expanding, or the airways are obstructed. So you have problems inhaling versus you have problems exhaling. And the only exception is emphysema, which is a lung problem, but it still falls in the obstructive category because it acts like an airway problem. Glomerular versus tubular, the two parts of the nephron. The glomerulus is here, the tubule is here, and the glomerulus is where you have the nephrotic versus nephritic diseases, whereas the tubule is where you have ATN, tubular necrosis, versus interstitial nephritis. So the two parts of the nephron, the two types of intrarenal diseases in the kidney, in the nephron. Then you have intrarenal versus extrarenal. It's either a kidney problem inside the kidney or it's not inside the kidney. It's just one of the tubes that surrounds the kidney. Extrarenal is going to split into pre-renal versus post-renal, before versus after the kidney. Before the kidney, you have the renal artery. After the kidney, you have the ureter. So basically, it's either a blood problem, which is pre, or a P problem, which is post. Then you have blood versus lumen, which is the verses that you have in every type of physiology, basically, each organ system. So for pulm, you have blood versus air, the air being like the lumen of your airways, your bronchioles and everything, and your alveoli, and chemicals pass between them. In GI, you have blood versus the GI tract lumen, and things pass between them. In renal, you have blood versus the tubular lumen of the renal tubule. And so it's basically blood versus pee, and things pass between them. When things pass between them, it's called absorption and secretion. When you absorb it, when you take it into your blood, that's always called absorption. Absorption always means into the blood, not into the lumen or whatever lumen you're dealing with. Why? Because your blood is you. Your GI tract is not part of your body. It's continuous with the outside world. Your airways are not part of your body. They're continuous with the outside world. But your blood is part of your body. So when something goes into your blood, you're absorbing it into yourself. When something leaves your blood, you're secreting it out into the world, into your pee or your poop or whatever. Hep A versus Hep C, acute versus chronic. Carcinoma versus sarcoma, the two types of malignant neoplasms. Carcinoma means epithelium cancer. Sarcoma means connective tissue cancer. It means connective tissue or muscle. So when you have your histology, it's 3 layers: epithelium, connective tissue, muscle. Those 3 layers are always there in that order, basically all the time. So if it's here, it's a carcinoma. If it's one of these 2 guys, it's a sarcoma. Athero versus arteriolo. This is artery versus arterial, big versus small. DHP, dihydropyridine versus nitrates. This is going to be a calcium channel blocker that affects vessels, arteries, versus nitrates affect veins. So it's going to be an artery dilator versus a vein dilator, venodilator. So artery versus vein. Hepatic encephalopathy versus kernicterus. This is adults versus babies. Adults versus pediatrics. So this is when the waste that the liver is not breaking down goes to the brain. And this is when the bile that is not being gotten rid of by the liver goes to the baby's brain. It goes to their basal ganglia. And they have problems with movement. So adult versus peds. ARDS, acute respiratory distress syndrome, versus neonatal respiratory distress syndrome. Adult versus peds, adults versus babies. Fructose versus galactose, the 2 more complex sugars. Fructosemia or hereditary fructose intolerance versus classical galactosemia, the 2 severe reducing substances diseases, where you find reducing substances in the patient's pee. These are basically the same disease, but one is with fructose, one's with galactose. The severe ones are the hereditary fructose and the classic galactosemia. And then there's also a mild fructose one and a mild galactose one. Fruit versus milk. Fructose versus lactose. Neutrophils versus macrophages. It's like acute versus chronic. The first responders versus the second responders of the innate immune system. M1 versus M2, the 2 types of macrophages. Inflammation versus scarring. The first step versus the second step. Inflammation is always followed by scar. Inflammation first, scar second. So it's acute versus chronic. These are both chronic. This is like acute part of chronic. This is like chronic. And inflammation versus scar. One always follows one always follows the other. Inflammation is followed by scar. Blood versus lumen, I already said this. Inflammation versus neoplasia, the two main types of disease. Autoimmune versus infectious. Inflammation from within versus inflammation from without. You're hurting yourself versus a microbe is infecting you and hurting you and causing the inflammation versus your own body is causing inflammation. Developmental versus degenerative. Young versus old. Acute versus chronic. Subacute is the middleman. Hours and days versus months and years. Subacute in the middle is weeks. It's my loose definition of those timelines. Toxic versus traumatic. Damage within, damage from without. Epithelium versus connective tissue. The top versus the support underneath. In histology, they're always side by side with each other like that. Epithelium's on top. He always has connective tissue right below him. Adult versus peds. Thorax versus abdomen. The two parts of the torso. Most of the important stuff in medicine is in the torso. Thorax and abdomen. Then you have some stuff in your head. And you have some pelvis and some limbs. But if you remove your limbs, and your limbs are mostly just muscle and bone, it's not that complicated. If you remove your limbs, then you have basically just your torso, which is two parts, thorax and abdomen. And that's where all your important organs are that are so complicated to learn about. The heart, the lungs, the liver, the spleen, the stomach, the GI tract, which is small intestine, the large intestine, the kidneys, so much stuff. Space versus time. So time is a very important thing in medicine and test questions and everything. Time, I like to split it mostly into acute versus chronic. And then I just use space for the other side of it. And I call that my space-time framework. I say those words to help me to remember to think of these things and consider what's going on. Local versus systemic, that's space. That's another really big concept in medicine and test questions. Is this thing local or systemic? Is it one area or is it spreading everywhere? Focal versus generalized, same thing. Torso versus limbs, like I was saying. The main part of your body versus these other little things. Mild versus severe. That's a big thing too to help contrast things. Medial versus lateral. And in neuro, when you're looking at your brain and your brain stem and your spinal cord and all these things and all that stuff, medial versus lateral equals posture versus skill. So posture and balance versus skilled movement. Posture and balance has to do with your trunk and your legs to keep your balance, whereas skilled movement has to do with your hands and your fingers, the ability to play piano and stuff like that, which is, of course, lateral. Posture is medial, skilled movement is lateral. Anterior versus posterior in your brain and spinal cord and CNS, that is going to be motor versus sensory. Anterior is motor, that's why when you draw the central sulcus, in front of it you have the motor cortex, and then behind it you have this sensory cortex. And then when you look at the four lobes of the brain, the frontal lobe, front, anterior, is where motor is, versus the parietal, which is behind it, has sensory. And then the occipital in the back has vision, which is also a type of sensory. And then temporal has hearing, which is also a type of sensory. So you have motor in the front versus sensory in the back. And then with sensory, the parietal is your somatosensory, which is touch, the main type of sense, versus these other two guys are your special senses. Your special senses, which is split into two sides, vision and hearing, sight and sound. You have alpha versus beta in your sympathetic, vessels versus organs, blood vessels versus organs, heart and lungs. Then you have in your parasympathetic, which is opposite of sympathetic, you have your M1 and M2 versus M3. M3 is an important one that does basically everything, and then M1 and M2 are these random ones that do, I think, your brain and your heart or something. Goes like, I'm pretty sure it goes like this. M1, M2, and then M3 does everything, all this other important stuff. So it kind of goes down in order. 1, 2, 3. Organs versus the tubes that surround those organs. So, for instance, your heart is the organ, and then it has these vessels that it pumps into and receives from, and that makes your cardiovascular system. So organs versus tubes is cardio versus vascular. And it's very helpful to think about the organ system as split into those two parts because they're two separate components that have their own stuff. Cardio versus vascular makes cardiovascular. Then organs versus tubes equals lungs versus airways. Airways means the trachea, the bronchi, the bronchioles, and all that stuff. And then the lungs are made up of alveoli. So organs versus tubes is going to be lungs versus airways, which is going to be restrictive disease versus obstructive disease. And then organs versus tubes could be the kidneys versus the renal artery and the ureter. So organs versus tubes, intrarenal versus extrarenal. The prerenal and postrenal are both extrarenal tubes. So all of these organ systems split into organs versus tubes for the most part. And it's helpful to think of them that way. Male versus female, man versus woman, boy versus girl. A lot of stuff that diseases that are associated and based on which bucket. Fat versus water is a big thing for farm and everything. Hydrophobic versus hydrophilic and all that. Fed versus fasted, insulin versus glucagon. And that's the same as that. Artery versus vein, very important difference. Big, strong, weak, and floppy. Go away from the heart versus going to the heart. Because the heart is very vain when it wants to feed itself. It's being very vain. So veins go back to the heart. Clot versus bleed. So don't bleed versus do bleed. Opposites. Red versus white cells. Red blood cells, white blood cells, feeding the body versus fighting for the body. And then in the middle, I call it pink for platelets. These three types of cells are the only three types of cells that are made by your bone marrow. So when you talk about heme and blood cells, it's only three types. Red versus white with platelets in the middle. And I call platelets pink to keep the color theme. So red, pink, and white. When they're all low, you call it pancytopenia because it means everything is low. Serotonin versus dopamine for psych drugs, psychiatry, pharmacology. Serotonin versus dopamine and norepinephrine is the odd man out in the middle. So those three make up the monoamine theory, and basically all the psych drugs either affect serotonin or dopamine or serotonin and norepinephrine or norepinephrine or norepinephrine and dopamine. So it's like combos of these guys. Either one of them can work together with norepinephrine for certain drugs, but I don't think serotonin and dopamine ever work together in the same drug, so that's why they're opposites. These are the two big important ones: serotonin, which can cause serotonin syndrome, and dopamine, which can cause neuroleptic malignant syndrome, NMS, SS versus NMS. Norepinephrine doesn't cause an exciting thing like that. Another reason why it's the odd man out. So the two most important ones are serotonin and dopamine, then norepinephrine's like a sidekick. PBC versus PSC, B versus S, women versus men, biliary versus sclerosing. Scar here versus not scar. GI versus nutrition, in the tract versus outside of the tract. Basal ganglia versus cerebellum, they both have to do with coordination. Basal ganglia is what lets you decide to move versus cerebellum is what lets you keep the move steady once you've already started doing it. In other words, basal ganglia initiates movement, cerebellum maintains movement. Start versus maintain. The beginning versus during. So then structural proteins versus enzymes. Enzymes do things, structural proteins don't do anything. They're just like brakes. They just sit there, and that's what they're good for. They don't physically like break things down and all that stuff. So structural proteins tend to be autosomal dominant, and mutations in enzymes tend to be autosomal recessive. So when you're looking at diseases, VD versus volume of distribution versus clearance. They kind of take the same place in the formulas. So like when you're looking at, I don't even remember, like excretion versus whatever, that farm stuff. When you're looking at going into the body, you use VD. When you're looking at going out of the body, peeing out, you use clearance. But like they're almost interchangeable in the formulas in a way. So they're opposites. Normal versus abnormal. Pulmonary versus systemic. You have two circulations because you have two hearts. Basically, you have two separate hearts is how I think of it. Your right heart pumps to your lungs. That's your pulmonary circulation. Your left heart pumps to your body. That's your systemic circulation. So you have two hearts that pump to two locations. The body is bigger than the lungs, so the left heart is bigger than the right heart. Your left heart pumps to your body because there's only two destinations, the body or the lungs, right? Most of your body gets pumped to by the left heart, but your lungs are so special, they have their own heart that does nothing other than pump to them. It's a heart that's just for the lungs. So since the right heart pumps to the lungs, it has to receive from the body. And since the left heart pumps to the body, it has to receive from the lungs. You cannot receive from the same one you're giving to. So whenever there's a problem with backup and the right heart is backing up, blood is backing up from it because it's not going forward. When you have a problem with forward flow and the right heart backs up, what's it going to back up to? The thing behind it, the thing that it receives from, so the body. And when the left heart is not pumping well and the blood starts backing up, where's it going to back up to? The lungs. So I like to think of them as two separate hearts for the two separate circulations. Then odd out is the guy that's not even part of your heart, the portal circulation. That's just liver stuff, a whole another thing. JVD versus ascites. This is fluid backup in the thorax versus fluid backup in the abdomen. So this is a heart problem versus a liver or kidney problem. So it's up high versus down low. Hey, up down versus down low. Up high versus down low. Staph versus strep, the two strongest, most famous, most important gram-positive bugs. When it's positive, your first thoughts are staph versus strep. When it's a skin infection, your first thoughts are staph versus strep. Impetigo, erysipelas, which I call erystrepilus, cellulitis, fasciitis, all those skin things, derm, are caused by staph and strep. Then you have the other gram-positive pair, which is gram-positive rods. So staph and strep are the gram-positive balls, which are called cocci. Then you have the gram-positive rods. When it comes to gram-positive rods, you have the rods that make spores, the special spore-forming rods, Bacillus versus Clostridium. And then you have the rods that don't do anything special. They don't make spores. And that's Listeria versus Diphtheria, and they rhyme. Listeria versus Diphtheria. And then Bacillus versus Clostridium, it's BC, like before Christ. So they go together too. And those are all the gram-positives because gram-positive is so rare that there's only like a few. There's a pair of balls, a pair of rods, and a pair of spore-forming rods. And that's like all your gram-positives. So few of them. Then everything else in micro is gram-negative, which is very generic. E. coli versus Klebsiella are the two big guys for GI stuff I think about. They're gram-negatives. E. coli versus Proteus are the big pair for UTI, urinary tract infection, nasty stuff down there. Strep epidermidis versus Pseudomonas is the pair for like hospital devices, getting infections from them. Catheters are going to be epidermidis, then all the other hospital devices that are not catheters are going to be Pseudomonas. Strep pneumonia versus Neisseria meningitis are my two big guys for meningitis, with Haemophilus influenza as the third one. So they form that triangle. Validate versus ask are the two things that you always choose for ethics problem, basically no matter what. You validate their concerns, and if there's not an answer choice doing that, then you ask the patient to tell you more about the situation. You don't give advice. You don't take action. Those are the bad A's. There's only one good A for ethics. Ask. Can you tell me more about this? How do you feel about this? Etc., etc. That's what you choose for ethics. Or you can validate if they have that in the answer choice instead. I know this must be so hard. And don't say but after. I know this must be so hard, but you should do this. No, just validate. Amyloid plaques versus tau tangles, the two things you see in Alzheimer's. Cardio versus pulm, the two things in the thorax. Kidney versus heart, the two kings of blood is what I call them. Because the kidneys make your blood, and the heart, the kidneys basically like control the amount of fluid in your blood. So they're basically like controlling your blood. Versus the heart moves your blood. It distributes that blood throughout your body. So basically, when you're talking about blood stuff, automatically think of the kidneys and the heart. Don't just think of the heart. Everyone thinks blood equals heart. No, it's just as often it's the kidney that has to do with blood, or maybe even more often. Kidney is actually more important. And with the way it's spelled, I call kidney the king because it's K-I, and because it's actually more important than the heart. And I actually call heart the queen of blood. So a little bit sexist there, but you got to do what you got to do for the mnemonic. So they're a couple, and the point is to remember that the kidney is really important for blood. So don't just forget about kidney and be thinking about heart all the time. That's why kidney is more important. He's the king, and then heart is just the queen. Reflex RAS versus reflex tachy equals kidney versus heart. So when blood pressure is low, the heart responds by freaking out and beating faster, tachycardia, trying to compensate for it, which doesn't even work, by the way. And then when the blood pressure is low, the kidney will respond by doing a RAS response, renin, angiotensin aldosterone response, to try to increase your blood pressure by retaining fluid. So they both respond to the same thing, blood pressure, the same end goal. They both have their own response they do to try to maintain that blood pressure when it drops low. That's one of the reasons why they're the kings of blood. Lungs versus liver. These are the two L's that take an L by always receiving cancer. So it's like when cancer metastasizes, it usually wants to go either to the lungs or the liver. These guys also both get screwed over by alpha antitrypsin deficiency, which is that disease where the person has too much trypsin, which is an enzyme that basically eats everything up like a piranha and destroys it. And so it destroys two organs, the lungs and the liver. So it cuts up all the alveolar septa, and it gives them emphysema in their lungs. And then it also cuts up their liver and gives them liver problems. So lungs and liver, they're both affected by cancer metastasis, and they're both affected by alpha antitrypsin deficiency. So they're a pair in these diseases. Cardiovascular are the two parts of cardio, right, of that organ system. Cardiac output versus blood pressure are two important goals of the cardiovascular system. So the cardio is responsible for the cardiac output, but then the vascular contributes a lot to the blood pressure. So cardiac output is something that your heart does, but why does it do that? Because it's trying to maintain blood pressure. So the blood pressure is the most important thing. That's the end goal. Your cardiac output is, of course, called cardiac because it's determined by the heart. Whereas your blood pressure, while the heart does contribute to it, it's kind of more strongly affected and more associated with the blood vessels with the vascular side of things, because the vessels can, all they have to do is squeeze harder and constrict and increase resistance, and then your blood pressure is going to shoot up. Versus if the vessels dilate, your blood pressure goes down. So it's kind of like cardiac output versus resistance, or you could say cardiac output versus blood pressure if you want to get more loose with it. That's cardio versus vascular. Lungs versus airway, already been talking about this. Restrictive versus obstructive. Inhale versus exhale. NADPH oxidase versus myeloperoxidase. These are the two guys that create ROS. Versus glutathione and superoxide dismutase are the two guys that break down ROS. So make versus break, reactive oxygen species. So NADPH oxidase makes one, I don't remember which one, it's like some normal basic one. And then myeloperoxidase makes the strongest one, HOCl, has chloride in it, which is bleach. So I think of it like super strong bleach that can destroy and burn everything. Then these two break it down to protect. So these two make ROS to kill germs and stuff, and then these two break down ROS to protect your body from that explosive force, that destructive force that is ROS. Then you have glutathione and NAPQI, which both protect you against something. I think ROS or something. I don't remember. Then you have NAG and NAM, the two walls that make the bacterial cell wall. Then you have resistant penicillins versus aminopenicillins. The tough pencils is my nickname versus the sharp pencils. Tough versus sharp. Good at defense versus good at offense. So the resistant ones, they are resistant to beta-lactamase, versus the amino ones, they're like sharp enough to pierce through the cell membrane pores, and they can like penetrate inside the freaking bacteria. So they're not, even though they're penicillins which attack the wall, they can, because they're sharp enough to pierce through, they can do more than just attacking the wall, and they can like kind of get at the inside too, and they can allow main example is aminoglycosides to get inside the cell. And aminoglycosides attack the protein production inside the cell. They don't attack the outside. So, but they can't get inside themselves. So aminopenicillin is sharp enough to pierce through that membrane and create an opening to get inside. So because of that sharpness, because they can get inside, aminopenicillins, that makes them different from other penicillins. And that makes them kind of better and stronger. So aminopenicillins are like way more broad spectrum than most of these other penicillins or penicillins and like stuff like that. So these are kind of better. These are like used a lot, not these. Factitious versus malingering. The two types of like faking, lying, pretending type of stuff. Factitious is when somebody's like purposely going to the hospital pretending to be sick. Malingering is when they're doing it for secondary gain. Versus factitious is like, I don't even remember exactly the distinction, but it's important to know. So that's a pair, because they're similar, but there's one distinction. REM versus NREM. Dreams versus not dreaming. Awake, when you're dreaming, your mind is awake, which means your body is paralyzed. That's REM. Versus in NREM, you're not dreaming, which means your mind is not awake, which means your body is awake. So this is where they're not paralyzed and they can do sleepwalking and all this stuff. Another one is nightmares versus night terrors. Nightmares are dreams, so they fall under REM. Night terrors are the opposite, so they fall under NREM. And then the main one of NREM is N3 in my mind. A lot of the stuff like night terrors and sleepwalking happens in N3. So it's REM versus N3, which you could say N5 versus N3. Or sorry, N means NREM, so there's not N5. It's just the fifth stage versus N3. It's fifth, right? Yeah. N4 we kind of skip because it kind of doesn't matter for some reason, if I remember. Then the two less important NREMs are N1 versus N2. N2 has some buzzwords like sleep spindles and something with a K. And then N1 is like, so doesn't matter kind of to me. Airspace versus interstitial, the two types of lung diseases. Lung is restrictive. And so it splits into two types. It's either the airspace that's affected or the interstitium that's affected. In other words, it's either the alveoli that's affected or it's the alveolar septa that are affected. It's either that space inside the alveolus or it's the wall around the alveolus that's affected. Your lung is made completely of alveoli, so there are only two things inside your lung that are part of your lung that can be affected by disease. It's either going to be the alveolar space or the alveolar septa. Either way, it's alveoli. So this is basically two parts of the alveoli. DIC versus von Willebrand. Too much clotting, which affects your platelets and coag factors, versus this basically just affects your platelets, but can affect your factor VIII a tiny bit. So it's primary and secondary versus just primary. Or you could view it as they both affect both, but this affects both significantly, whereas this affects mostly just one. It's mostly just primary. Endocrine versus exocrine. I'm getting tired of this. Neuro versus vascular. These are the two quote-unquote rivers that run through your body. I call them rivers. Your nerves run through all your body, and then your blood vessels run right beside them, right? One is to feed your body parts. The other is to control your body parts. Giving food versus giving commands. Which one do you think your body parts like more? Ha ha ha. Bile versus pancreas, the two twins that both digest fat. The first step versus the second step of digesting fat. Stomach versus pancreas, they're both in the same location, like the umbilical region, because the pancreas is right behind the stomach. So when you have pain in that region, it's automatically either a stomach problem or a pancreas problem. Liver versus bile, they're both right upper quadrant, same location. They're both very connected, doing their thing. The gallbladder versus the bile duct, the only two parts of the biliary system. All the diseases either falls into a bladder problem or a duct problem. Acinus versus duct, the two parts of any like duct. You have the acinus, which is kind of like the gallbladder in a way. It's like the beginning where the stuff is made. Then you have the duct, which is where the stuff gets shot out. The stuff that you're making in that duct. So even though they call it duct, when they're talking about ducts on histo, really a duct has two parts, the acinus versus the actual duct. It might also be called the lobule versus actual duct, like in the breast. In the breast, it's called lobule, but it's the same idea. Early tubule versus late tubule. Okay, I'm tired.